Hello, this is Dr. Feast Price, and welcome to Week 8. For this week, we'd like to continue our knowledge on family therapy approaches. Thus far, we've talked about Bowen's family therapy, existential family therapy, cognitive family therapy, and cognitive behavioral family therapy. This week, we'll be discussing structural family therapy, strategic family therapy, solution-focused family therapy, and narrative therapy. For the purpose of this lecture, our focus will be on structural family therapy. So the overview for this lecture is to provide a detailed overview and understanding of structural family therapy, as well as a detailed understanding of what strategic family therapy entails. And so when we think of structural family therapy, we know that Salvador Minuchin is the founding father of structural family therapy. And this therapeutic approach is a systems approach that views the family as an organism undergoing transformation. So the family functions as a system, and it is undergoing some level of transformation. The life history of a family is viewed as a series of attempts at keeping a desirable balance between stability and change. Also, the family is seen as one system that exists as a subset of a larger social system, and it contains smaller social subsystems as within its boundary. So if you consider what a larger social system is, you can consider our government, our communities, our states. So we have these larger systems, and then we have families that are a part of these larger systems. And within the family, there are smaller social subsystems. And so this typically entails some of the coalitions that exist within the family. So if you think of a family of three, sometimes there's a coalition between two persons within the family, and the third person is kind of like the odd man out or the outlier within the family. And so one of the attempts of structural family therapy is to assist in identifying appropriate boundaries. Minuchin also believes that a family is functional or dysfunctional based upon its ability to adapt to various stressors that might exist within the family, which in turn rests upon the clarity and appropriateness of its subsystem boundaries. So the extent to which a family can adapt to various stressors, maintain appropriate boundaries, and minimize coalitions speaks to the functionality or the dysfunctionality of the family system. Boundaries are characterized along a continuum from enmeshment to diffusion, and so you might have families where everyone within the family is closely enmeshed, and there are other times when on the opposite end of the spectrum where families are very diffuse, and there's a lot of separatism and diffusion within the family. So the boundaries that exist within the family are both physical and psychological factors that separate people from one another and the way in which they organize themselves. So family subsystems are characterized by a hierarchy of power, typically within the parental subsystem, also known as the system that is on top. And then there is an offspring subsystem that includes the children within the family. The premise of structural family therapy is that family functioning involves the family structure, the subsystems, and the boundaries. So just to explain it a different way, structural family therapy involves the family structure. How is it structured? Is it a family that involves just the nuclear family? Is it a family structure that involves extended family? What are some of the subsystems within the family? Oftentimes that might include coalitions, or the top system, which might be the parents, with another subsystem being the offsprings of the family. And boundaries, as we communicated already, are those physical and psychological factors that separate people from each other within the family system. So based on understanding the nature and interplay of some of the roles, rules, and power within the family will dictate some of the ways in which a structural family therapist would intervene. So when we explore the roles of the family, oftentimes it has to do with the role of the husband, the wife, or the two partners, along with the children. So sometimes it might mean the mother. If you consider a more traditional family, it might entail a mother who is the nurturer or caregiver within the family. She may be a stay-at-home mom. It might be the father who's the protector, the breadwinner, and provide for the family's resources. It also entails some of the rules and expectations, some of the oughts and musts that exist within the family, and that might have anything to do from religion to education to extracurricular activities. And so the rules speak to some of the nuances and expectations that are governed within a family system. And lastly, power within the family speaks to who are the persons in power, how is the power disseminated, and how does the power structure, how does it influence the family system or impede the family system. So the role of the therapist within structural family therapy is that of an active intervening agent, which challenges the family's reality. So again, the role of the therapist in structural family therapy is the role of an active intervening agent who challenges the existing family reality or the existing family structure. So some of the characteristics of a healthy family, there are appropriate parent-child boundaries that are both clear and semi-diffused, which allows the parents to interact together with some degree of authority and negotiating between themselves the methods and the goals of parenting. So it's parents who are in a position of parenting who negotiate some of the goals and expectations for the family. And with the children, the parents are sufficiently unmeshed from the children to allow for the degree of autonomous sibling and peer interaction that produce socialization, yet not so rigid or aloof as to ignore childhood needs for support, nurturance, and guidance. So whenever there is functional families, there are also dysfunctional family systems as well. And according to Mnuchin, dysfunctional families exhibit mixed subsystems, for example, coalitions. And we said that coalitions are those relationships or micro relationships that exist within the family. So if you think of double teaming that exists with the family, or another, Bowen referred to it as triangulation. And so when you have three people in the family and two of the people might go against the third party, it's known as a coalition that exists. And in such, there are improper power hierarchies. So for example, when an older child is brought into the parental subsystem to replace a physically or emotionally absent parent. So sometimes in family systems, for myriad reasons, whether it be substance abuse, single parenthood, whatever the family circumstance might be, children are put in positions where they have to assume more mature, responsible roles than they should in light of parents having specific roles and responsibilities. So this speaks to some of the dysfunctional issues that might exist within the family system. So structural family therapy, as per Mnuchin, has specific views of maladaptive behaviors within the family. And it espouses that family dysfunction is viewed as the result of an inflexible family structure that prohibits the family from adapting to maturational and situational stressors in a healthy way. So, as a result of some sort of family dysfunction, family members are unable to cope appropriately with some of the natural and normal situational and maturational stressors because of inflexible family systems or structures. So some of the therapeutic treatment goals of structural family therapy is to restructure the family in some kind of long-term treatment goals. So you're identifying the long-term goals of the family and you're assisting them with restructuring the family. So if the goal is to have the mother of the family to be more functional and engaged in parenting, and the goal is such, then you would assist the family in setting appropriate goals and expectations and following through on their new positions of status within the family. Also, one of the goals of structural family therapy is to provide relief of symptoms that could be short-term goals. So perhaps it might be a chaotic situation where you might have some short-term goals that might complement the long-term goals. So in addition to obtaining the long-term goal of the parents assuming the primary responsibilities within the family, there may be short-term goals that might require the parents to carry out certain activities, certain short-term activities, with the expectation that they will ultimately achieve the long-term goals in parenting. So the format of structural family therapy sessions are as follows. So the structuring desired subsystems by isolating them from the remainder of the family, either by the use of space and positioning. So for example, if the family comes in for therapy and you know that there's a coalition that exists between, let's say for example, the mother and daughter, you would position them in the room in a way that they're not sitting side by side. So maybe they might be sitting on opposite ends of the room. Or by having non-members of the desired structure leave the room, but stay involved by viewing the family dynamics behind a one-way mirror. So the restructuring, just to paraphrase, is it might be repositioning in the space whereby the people with the coalition or with the relationship are not seated together, but instead are seated separately, so it diffuses or breaks up the coalition. Or there may be a situation whereby the people that are in the coalition are in the session with the therapist, and the third parties, the ones that are not a part of the coalition, are able to observe the substructure or coalition behind a one-way mirror. And so the aim at this particular structure of therapy is to cause the unbalancing of the family system in order to help them to see the dysfunctional patterns and to be open to restructuring. And so sometimes through a form of reality-based therapy where you disrupt the existing functioning and you bring about certain realities to the forefront, it has a tendency to unbalance the family in an effort to restructure the family in a more balanced format. There's also change. It's the recognition that change must be gradual and taken in by digestible steps in order for it to be useful and lasting. So change doesn't occur rapidly, but in small, digestible steps. And the therapeutic change is likely to be maintained beyond the limits of the therapeutic session when you can incorporate all of the above. So some of the techniques that might be used in structural family therapy includes the following. So based on the premise that action precedes understanding. So action comes first and then the understanding. So disrupting the coalition comes first, and from the disruption of the coalition comes a certain level of understanding. It's also geared more towards changing behaviors and transitions and transactions rather than fostering insight. So it's more behavioral focused. It's the focus on actions or behavior, and it's the belief that if you change the behavior, insight is gleaned through that process. It also involves 3 overlapping steps. One is joining, whereby the therapist would join or become a part of the family system, and in so doing will disrupt the family system. There's also evaluating the family structure, whereby the therapist will ask questions and evaluate and make certain changes within the family. And in so doing, they are restructuring the family in an effort to bring about more cohesiveness and balance. So one of the things that's really evident, if you think about it and you relate structural family therapy to behavioral therapy, it's action-oriented, it's behavior-oriented, which comes from the perception that through the actions or the behavior change, insight will follow. And that's really consistent with behavioral therapy. The focus is on the present and the here and now, and very little, if any, attention is given toward cognitions and feelings. Just to further understand the 3 overlapping steps, I'd like to provide greater detail. And so when we consider joining as the first overlapping step, and this is just to give more detail, it says that the first task of the therapist is to develop a therapeutic system by joining the family in a position of leadership. It involves blending with the family, and it includes tracking by identifying and using the family values, life themes, and significant life events in order to be a part of their conversations. It also involves nemesis, whereby the therapist adopts the family's affective as well as verbal communications. And so when you consider some of the ways of joining the family, it actually puts in mind anthropologists and what they do in order to effectively carry out the work that's done. And so with an anthropologist, what they do is they infuse themselves in the family or the community by joining the community. And when you become a part of the structure, you have a better understanding of what some of the issues are, the values, the themes, significant events. And also, people are more likely to trust you and develop a trusting therapeutic relationship because they perceive you as being a part of the family structure. We also identified evaluating the family structure as one of the core overlapping steps of structural family therapy. And once the therapist joins the family, he or she is in a position to evaluate the family structure, including its transitional patterns, so how they navigate the different patterns, the power hierarchies, which might be with the parents or the children, as well as the boundaries. And that could be both psychological and physical boundaries that separate people from each other within the family. So the evaluation, which may include construction of a family map, will enable the therapist to make a structural diagnosis from which specific goals of therapy can be derived. So for example, what you might do in the evaluation process is develop a family map, that looks at some of the strengths of the family, some of the boundaries that exist. You might want to strengthen certain areas of the family, whereby in other areas you want to suggest some changes. And so it would help by strengthening some of the boundaries that might exist in an enmeshed family, whereby if they're too enmeshed, then you want to help them to have more boundaries and become diffused. And so this is also consistent with some of the things that we talked about with Bowen therapy, where he talked about families becoming more diffused. And here they're talking about strengthening some of the boundaries that might exist within the family. So again, this goes back to what I mentioned to you last week, that there's not a lot that separates these therapeutic approaches. However, it might be some of the terminologies that are used. So whereby in structural family therapy, they talk about coalitions, as well as they talk about coalitions in structural family therapy. In Bowen's therapy, he identifies it as triangulation, and whereby Bowen talks about boundaries and strengthening the family boundaries to avoid or to minimize enmeshment. Bowen talks about the use of diffusion or diffusing families. So it's just important to pay attention to some of the overlapping characteristics that might exist in many of the treatment approaches. So as it relates to restructuring the family, a number of techniques are used to deliberately unbalance or cause stress on the family's homeostasis in order to facilitate transformation of the family structure. And among those imbalancing techniques that are used, it might be enactment or reframing. So as it relates to enactment, it's the family members who are asked to role play their relationship patterns so that they can be identified and altered. So they have role playing opportunities within the family so that others are able to observe, become enlightened, and then as a result alter their ways of behaving and interacting. Reframing is another restructuring family technique that's used, and it involves relabeling behaviors so that they can be viewed in more of a positive way. And so rather than seeing certain kinds of behaviors as negative, it reframes cognitively. You're reframing some of the ways in which behaviors are made sense of. And this reframing is consistent with cognitive behavioral therapy. And so in cognitive behavioral family therapy, one of the primary foci of this therapeutic approach is reframing. So again, that's another way by which you can make connections across some of the therapeutic approaches, which is symbolic of the fact that there is a large amount of overlap and consistency across the approaches. So with structural family therapy, for families who are less introspective and are oriented toward concrete thinking, Mnuchin will use the subsystem isolation one-way mirror technique to teach those family members on the viewing side of the mirror to move from being an enmeshed participant to being an evaluation observer. So with this one-way mirror, while the family, some families are working with a therapist, behind the one-way mirror, there are certain instructions that are taking place by an additional therapist that are helping the family members to understand what some of the problems and the limitations are with the functioning and behaving. Mnuchin then joins these members in the viewing room, pointing out the patterns of transactions occurring on the other side of the mirror. So again, it goes back to some of the instructions that are taking place. And it's important to understand that when you're working with families, You will have families at times that have a limited ability to be introspective. Their ability to comprehend some of the things that you're communicating might seem very abstract. And when that does happen, Mnuchin believes that this one-way mirror technique is very essential in expanding the knowledge base of family members and helping them to see from more of an instructional process how their behaviors are being either productive or counterproductive, and to help them to understand how behaviors should change.